In this video, I will discuss Piracetam and aging. Piracetam is used for improving mental performance in aging, non-deteriorated individuals. In middle-aged and older individuals who do not yet suffer any specific neural malady or major mental impairment, it can slow down or postpone entropic brain aging and even reverse some mild neural mental decline. Have you ever watched an out-of-practice musician? One's nimble fingers skip familiar notes. A common expression is to say he grew rusty. That is actually not so far from the truth. Rust, what we see on a bicycle left in the rain, is an example of oxidation. Oxidation occurs when molecules are ripped apart by reacting with oxygen. In the case of rust, it's the reaction of iron with oxygen. Oxidation occurs in the body too, and in the brain. Piracetam reduces oxidative stress and it protects the brain from neurological toxins. If using Piracetam consistently, the same person at age 50 might be smarter, have better memory, quicker reflexes, and greater vigilance and alertness than when they were 40. The best results come from higher dosages, synergizing Piracetam with brain growth and repair factors, and, very importantly, consistency of use. For neuroprotective effects, preventing problems before they arise, a good dosage is 2,400 mg per day in 3 doses with water. Remember, take Piracetam on an empty stomach whenever possible. The upper range daily dosage of Piracetam is 24 grams per day. Piracetam is not metabolized to any other substance. This means no extra work or burden is placed on the liver, and it is completely excreted via urine. Piracetam is useful both for the chronic and accumulating daily damage to the brain, but also for acute damage. Stroke victims might avoid paralysis and death if given drugs like Piracetam after entering the hospital. Even in patients who suffered stroke-induced brain damage years ago, there is evidence that Piracetam helps improve the functioning of these damaged people. Piracetam has restored various functions, use of limbs, speech, EEG, state of consciousness, in people suffering from acute or chronic cerebral ischemia, decreased brain blood flow. Piracetam has improved alertness, cooperation, socialization, and IQ in elderly psychiatric patients suffering from senile involution, dementia, Alzheimer's, Parkinson's. Piracetam is useful as a long-term treatment for clotting, coagulation, and vasospastic disorders, such as Raynaud's disease and deep vein thrombosis. One last tip. Remember that Piracetam potency is increased when taken with lecithin, choline, DMAA, or other acetylcholine precursors. There are also hydrogen, fish oil, and many other supplements which can increase the effectiveness of Piracetam for both treatment and cognitive enhancement. In summary, Piracetam is very useful for the prevention and treatment of neurodegeneration and some forms of vascular disease. Additionally, it is completely non-toxic. This is why Piracetam is a very important agent for any worthwhile anti-aging therapy. In this video, we have discussed Piracetam and aging. If you want to learn more useful things about Piracetam, then go to damianalexander.com/piracetampdf. If you want to learn more about critical nutritional supplements, life extension, and disease prevention, then subscribe to my YouTube channel at Damian Alexander's Vids. Lastly, discover the easiest and shortest way to double physical and mental energy, strengthen immunity, and restore health by visiting howtochangeyourOwnbatteries.com.